good additional example of what may be philosophical differences, but what we may have in common. Rather than go through the problem, because I think everybody understands out there the issue of people with pre-existing conditions not being able to get insurance, people coming up with bumping up against lifetime caps and suddenly thinking, as a family I met in Colorado, they thought their child was covered. Suddenly they hit the lifetime cap and they started having to scramble to figure out how they pay the additional costs. We all are familiar with these examples. I just want to go through areas where I think we agree on insurance reforms, or at least some Republicans and some Democrats agree. I think that we agree on the notion that you can't just drop somebody if they've already purchased coverage. Looking at your bill, John, the idea that you ban rescissions. We agree on the idea of extending dependent coverage to a certain age. Some people that we want to end the prohibition on pre-existing conditions. I think the thing we're going to have to talk about is how do you actually accomplish that? There may be a disagreement as to whether you can do that without making sure that everybody's covered. But that's something that we can talk about. In addition, though, there are some other insurance reforms that have been proposed by the House and Senate in their legislation that I think we should explore. And maybe we can narrow the gaps there and come up with some, even a longer list of areas that we agree on. So what I do is, since I want to make sure that Mitch doesn't give me a time clock tally again, let me first go to Mitch, and I don't know who wants to make the presentation with respect to insurance reform.
Mr. President, I'd like to yield to Dr. Bastani to continue this conversation about insurance reform.
Thank you, Leader Boehner, and thank you, Mr. President. I come at this as a physician, a cardiovascular surgeon with over 20 years of practice doing open heart surgery, dealing with patients who have come to me with very, very challenging cases at very difficult times in their lives. And along with my colleagues, Dr. Coburn and Dr. Barrasso, we bring a wealth of experience in dealing with insurance companies and all these everyday problems that so many American families face. We all agree that we need insurance reform. There's no question about it. The question is, how do we do it? Now, we've all been through a long year. Town hall meetings, telephone calls, emails, it goes on and on. And one thing that has become very clear, the American people have spoken out very loudly and very clearly. They want us to take a step back and go step by step with a common sense plan that really brings the cost down for American families and small business owners. They want insurance companies to treat them just like they treat big labor unions and large companies. It's been a resounding message we've heard over and over. So how can we achieve all this? Well, we've talked about some of it. I think one of the things we ought to really look at is how do you simplify, streamline, and standardize all the paperwork that's involved? Because I can tell you as a doctor, and my two colleagues who are physicians will know, that it takes you away from patient care. It interferes with the doctor-patient relationship. It runs up cost in medical practices, and it's a real issue. So I think we can all agree on that. We need to address that issue. A second area is how do you really promote choice and competition? We've all talked about it, and I think we've had a lot of discussion already on those issues. We put forth a plan earlier in the year during debate that actually the Congressional Budget Office showed that it brings down the cost of premiums up to about 10%. And actually for individuals seeking and families seeking insurance in the individual market, those cost savings could even be higher. As opposed to the bill we have here, where we've had some discussion already, and Mr. Camp has already outlined, as well as Mr. Kyle, that this bill would actually raise premium cost. We've talked about small business health plans. You know, again, I ran a small business. It was a medical practice. And when I wanted insurance, when those premiums were going up in double digits every year, I'd call an insurance agent. They would come in. And we had very limited choice. Very limited. And the cost kept going up. Small business health plans is one way to really deal with this and allow for pooling. And where our big disagreement is, frankly, with how you do it. And if you create a plan with exchanges that are overly restrictive, it really doesn't, it defeats the purpose. And I believe we can have faith in the American public to figure out, if it's transparent enough, what's their best deal? What's the best deal for a small business owner or a family in this sort of arrangement? The same goes for purchasing insurance across state lines. I'm glad to hear our Democratic colleagues agree that this is an approach that needs to be taken to promote choice and competition. But again, we feel that this bill restricts those options too much. And we think we can do it in a responsible way. I believe we probably could come together on this. But I think the existing proposals restrict it far too much. Health savings accounts. These are very, very popular among small business owners and families. And I think the one impediment today is the inability to save enough in these. And I think there are ways that we could promote these health savings accounts and promote real savings that will actually make a difference. It won't solve all the problems, but it's an important insurance reform that I think small businesses will really jump on if we could expand those savings opportunities. The current bill, as has been stated, adds some restrictions and some additional tax provisions on these, which make them less palatable. We all agree on prohibiting insurance companies from arbitrarily canceling insurance policies. That's a no-brainer. There's a strong agreement on both sides of the aisle there. Now, with regard to pre-existing conditions, this is an issue that is very difficult, and many of us and our families may have been faced with it. I can tell you I faced it when I closed my medical practice because I had a health condition, an arthritis condition. And I went to the same insurance carrier that covered my small medical practice for 14 years and got the big red no. Can't insure you or your family. Now, that's frankly unacceptable. Now, what we propose is using risk pools, expanding these risk pools, and reinsurance. It's an affordable way to do it. It creates certainty for a family that's faced with this very difficult set of circumstances. Certainty is important. And our plan would not raise premium costs extravagantly, whereas the proposal here would raise those costs, and it doesn't really create the kind of certainty a family needs because there are waiting lists, and that proposal is only temporary to something else that we don't know what it's going to be. The other thing we do is we create a way for small business owners to actually shop and compare apples to apples. Transparency. And this is critical. Our plan does this without creating the kinds of restrictions that we see with the exchange process. And we agree that we have to eliminate annual and lifetime caps, so we have broad agreement there. So again, I think it's clear that the American people have rejected the bills that have gone through so far because they see increases in premiums for families. They see that it raises taxes significantly on families and raids Medicare to create a new entitlement. This doesn't really bring down the cost. This is really not the answer. What American families want is a common sense, step-by-step approach that will really lower the cost for families and small businesses.
All right.
I believe we have a duty to reform health care, but we have an obligation to get it right.
Okay. Thanks, Charles. We're going to go to George Miller, and if you want to respond to specific things that Charles raised or make some more general points, we'll then go back to a Republican. At some point in this discussion, and we're going to have to be a little more disciplined in our time in order to stay on schedule on this section. At some point, I'd like Secretary Sebelius, who is not only a former governor but also insurance commissioner, to address some of the issues that have been coming up around insurance and minimum payments.
Mr. President, I don't know if any of us were told of what the time limits are.
Well, I'm trying to be flexible.
I'm just curious
but
if you've got a certain amount of time.
We've got about half an hour remaining for this section. So if people can keep their
Thank you.
Mr. President,
points brief.
From the Senate, we have Senator Harkin and Rockefeller respond
Right.
for the Democrats.
And I've got a list. George?
very much. This issue of insurance reform is, I think, where most families intersect with their insurance companies, with the health security of their families. And let's start out with our commonalities in the bill that Congressman Boehner, Leader Boehner, offered on the floor. He agreed that lifetime caps should be abolished, that annual caps should be abolished, that young people should be able to stay on their parents' plan. I think it was 25. I think in your suggestion, Mr. President, is 26. So there's that kind of commonality there. But we think that, and our bill goes further in some of the suggestions you've made in the interim since the House and Senate had passed these bills, is that clearly we think that preventative care should not carry a copay with it, that we ought to encourage people to get that kind of preventative care for themselves, certainly for their children. We allow the health savings accounts to continue. That's a variation on, as my colleague talked about, what they think insurance reform should reflect. Clearly now, when we see the request in California for a 38% increase, in Michigan for 56% increase, I think in Maine is 27% increase. You've suggested stronger language than we have in either the House or Senate bill, I think along the lines what Senator Feinstein has been talking about in terms of rate review. People are trapped in these systems. But the one area where there still seems to be disagreement, it was not in the substitute offered by the Republicans when we were on the floor, and that is this question of pre-existing conditions, because this is a real trap for families. Either because you find out that you need to go to get care for a disease or an illness, and you may get a checkup and they may discover that you have arthritis, but you didn't disclose you had arthritis. So now that's a pre-existing condition, and you may lose that policy. You may have to provide more. And the fact of the matter is, you hate to admit this at my age, but I sit here with two artificial hips, a little bit of arthritis, and I have a kidney stone. I'm dead in that insurance market if I have to switch policies or switch companies or look for another chance. Now, why should that be? Those hip replacements have been with me for 15 years. And I have no trouble, but it's a way of denying me care. And if you have acne, it's a way of denying you care. In fact, what you see from one of the Blue Cross companies here is 3 pages of things that will keep you out of care, will keep you from changing your jobs. And it goes on and on and on. With those, back pain will keep you, a pre-existing condition. Acne that I mentioned, a cleft palate that we talked about earlier here. What means that? So what does that mean when you want to change jobs? What does that mean when you want to start your own company? It means you go without insurance. Or you pay some policy that has a $5,000 deductible or $7,000 deductible. This is a real issue to American families. 56 million people right now have insurance policies where pre-existing conditions can knock them out at any given time. We know that 13 million people were denied coverage over the last 3 years because of pre-existing conditions. And so now you're trapped. You have a pre-existing condition. You can continue maybe with that insurance company if you pay more, but you can't shop in the marketplace for another insurance company. You can't go from Blue Shield to Kaiser because you have a pre-existing condition. You start to see the economic trap and uncertainty that families are confronted with. Now, the interesting thing was, during these negotiations, Senator Dodd and I worked very hard on these issues. Most of the business community signed off on getting rid of these pre-existing conditions, and I think that that's important for us to understand that is what real insurance reform is. Should you still be able to charge women more than men? Should you rate based upon gender? To what extent can you rate based upon ages? To what's the essential benefit that we're providing? We can all describe that plan that's really inexpensive. It just doesn't have many benefits that go with it for families. And so I think that this is a very important part of this discussion. I know when I go home, my district, I hear about this from the people I represent. I hear about this from my wife, and she's talking about our kids and her friends and people she spends time with, how they struggle with these. And what we're really talking about is the manipulation to move people around within the insurance market. And yes, you can go to a high-risk pool. So yes, because you have a pre-existing condition, because I have 2 artificial hips, I can go to the most expensive insurance system in the country. I'm now in a high-risk pool, and I'm trapped in that high-risk pool forever. You can make it a high-risk pool among states. You can make it a high-risk pool among small businesses. You can make it a high-risk pool among large businesses. I'm still trapped in the most expensive insurance because of something that happened to me that I had no control over. I have a child with a cleft palate. I have a child with acne. How can this possibly be? Now, fortunately, in our discussions, as I said, a lot of the business organizations have agreed that these things should be phased out over time. Some can be put in right away, as it's not terribly expensive to cover people 18 to 26, and that can be done right away, and we have that commonality. So I would just hope that we would focus on this issue of what real insurance reform looks like with respect to the impacts on families and individuals as they try to navigate this insurance market.
Thanks you, George.
Mr. President, we'll turn now to John McCain.
Well, thank you, Mr. President. Thank you for doing this. And I understand the 4 categories, but there's a big category that the people in my state and across this country are deeply concerned about. And that's not just the product that we are examining today, the 2,400 pages, but the process we've gone through to reach that. Now, both of us during the campaign promised change in Washington. In fact, 8 times you said that negotiations on health care reform would be conducted with the C-SPAN cameras. I'm glad more than a year later that they are here. Unfortunately, this product was not produced in that fashion. It was produced behind closed doors. It was produced with unsavory, I say that with respect, deal-making. The Louisiana Purchase, funding of $300 million for one state. The Cornhusker kickback, which is, I understand now, been done away with. One of the things that, as provisions of this legislation that was particularly offensive was the carve-out for 800,000 Florida seniors exempt from cuts in Medicare Advantage program. There's 330,000 seniors under Medicare Advantage in my home state of Arizona. They're deeply concerned about that. They're deeply concerned about the carve-outs for Vermont, Massachusetts, Hawaii, Michigan, Connecticut. $100 million for a hospital in Connecticut. Why should that happen? They don't understand it. And at the town hall meetings that I conduct all over my state, people are angry. We promised them change in Washington, and what we got was a process that you and I both said we would change in Washington. So then we got into the special interests, whether it be the Hospital Association or the AMA or others, and one of them that was particularly egregious, and I won't go through the whole list, was pharma. Pharma got an $80 billion deal, and in return for which they ran $150 million worth of ads in favor of, quote, health reform. Their over $2 million a year lobbyist was here at the White House and was reported to say in the media, a deal is a deal. And part of that deal was that there would not be competition amongst pharmaceutical companies for Medicare patients. The other, well, among others, was that the administration would oppose drug reimportation from Canada, a proposal that you supported in the United States Senate.
John, can I just say...
Can I just finish, please?
Well,
and then at Christmas Day, I believe it was Christmas, the majority leader said, quote, a number of states are treated differently than other states. That's what legislation is all about. That's compromise. Compromise is not the word for that. So when my constituents and Americans now who overwhelmingly reject this proposal say go back to the beginning, they want us to go back to the beginning. They want us not to do this kind of legislating. They want us to sit down together and do what's best for all Americans, not just for some people that live in Florida or happen to live in other favored states. They want a uniform treatment of all Americans. So I hope that that would be an argument for us to go through this 2,400-page document, remove all the special deals for the special interests and favored few, and treat all Americans the same under provisions of the law so that they will know that geography does not dictate what kind of health care they would receive. I thank you, Mr. President.
Let me just make this point, John, because we're not campaigning anymore. The election's over.
I'm reminded of that every day.
So we can spend the remainder of the time with our respective talking points going back and forth. We were supposed to be talking about insurance. Obviously, I'm sure that Harry Reid and Chris Dodd and others who went through an exhaustive process through both the House and the Senate with the most hearings, the most debates on the floor, the longest markup in 22 years on each and every one of these bills would have a response for you. My concern is that if we do that, then we're essentially back on Fox News or MSNBC on the split screen just arguing back and forth. So my hope would be that we can just focus on the issues of how we actually get a bill done. And this would probably be a good time to turn it over to Secretary Sebelius. Who,
could I just say, Mr. President, the American people care about what we did and how we did it.
Well,
and I think we ought, and it's a subject that I think we should discuss, and I thank you.
They absolutely do care about it, John, and I think that the way you characterized it obviously would get some strong objections from the other side. We can have a debate about process, or we can have a debate about how we're actually going to help the American people at this point. And I think that's the latter debate's the one that they care about a little bit more. So, Kathleen, why don't you just address some of the issues related to insurance reform? There's some agreement here, but I know that on the Republican side there are a couple of concerns about the issue of rate review, the issue of setting up some benchmark standards that insurance companies have to abide by. Some people may think that those have been a little bit too aggressive. You've been both a governor as well as an insurance commissioner. Maybe you can talk a little bit about what you've seen at all those different levels and how you think we can best move forward to protect American families.
Well, thank you, Mr. President, and I know there are lots of people who want to comment on these topics, but I don't think there's any question, and I think there's a lot of agreement that the current insurance market really fails way too many people. It is a system that is not a market for about 40 million Americans who are either in an individual policy or in a small group policy, have no choice. There is no competition. According to the American Medical Association, in their study yesterday, 99% of the market in metropolitan areas, 75% of the markets across the country are very concentrated, which means they're monopolies. They're not markets. So we got a trap. And I think the rules allow people to be locked out from the front end if you've got pre-existing conditions, allow people to be thrown out with a stop on benefits during the course of a treatment, or when your policy expires and you're supposed to renew, you're dumped out of the market, or to be priced out, which is going on across this country. There's been a highlight of a couple of rates, but double-digit rates across the country, on top of double-digit rates, on top of double-digit rates, and people have no choices. So the common areas, I think, of agreement, high-risk pools. There are lots of states across the country running high-risk pools. As an insurance commissioner, we ran the high-risk pool in Kansas. It is a strategy that's been in place for almost 30 years in many states, 200,000 people total in the entire United States. are in high-risk pools because they're so expensive that they really don't offer it. Because when you put all the sick people together and you say, okay, you get to buy a policy and you get no help with that policy, it is a death spiral. You will always have the highest cost, and on top of that, the highest cost, and you've got the sickest people who are already paying the highest cost for treatment. They don't work very well. They are a stopgap measure that the House and Senate have proposed to get people from here to a new market. I think what the exchanges have a lot in similarity with the health plans that have been talked about by the House and Senate. There's a big difference, and it's not a Washington difference, it's a state difference. The state insurance commissioners across this country have unanimously opposed health plans for decades, and they feel that it takes people, it isn't the pooling that's objectionable, it's the fact that there is no consumer protection, that there is no ability to apply common sense rules. And we had the drive-by deliveries in Kansas where people were being kicked out of the hospital 18 hours after having a baby to save money, only to be readmitted with jaundice and to be readmitted with dehydration. It's not a particularly good idea. So getting rid of pre-existing conditions, getting rid of caps on yearly benefits and long-time benefits, allowing kids to stay on plans are ideas that have been accepted by both, setting up a new marketplace, giving small business owners and individuals choice and competition in the private sector, but making the private sector operate on a different set of rules, including having some loss benefit analysis. How many of those dollars, you heard Senator Coburn eloquently talk about the 30 cents of every dollar that goes to pay for expenses other than medical costs. A loss benefit analysis, a medical ratio would do just that. How many of your dollars are you actually spending on provider care, on prescriptions, on treatments, and how much is going to overhead and CEO salaries and advertising to try and get a handle on rates, having some rate review, having some transparency and some opportunity to have people make choices and make companies compete with one another and not separate the marketplace. I think the most dangerous part of the system right now is having people, having insurance companies pick and choose who gets coverage and who doesn't, based on your health condition. It's a lot cheaper to insure people who promise never to get sick. I watched it as insurance commissioner, but segregating that market is not insurance. It's not pooling a risk. And I think your proposal, Mr. President, gets back to the notion that there'd be a pool. There'd be an opportunity to pool that risk and have people have the kind of negotiating power as a governor. And like Senator Alexander, I am a former governor. We both ran our state employee health pools. I don't know about Tennessee, but in Kansas, that was the largest pool in the state, 90,000 covered lives. We had a lot of negotiating power. We could get a pretty good deal on a couple of companies competing on hospital rates, on doctor rates. That's what this kind of pooling mechanism and a new exchange would give everybody, and it's around a set of standards that made sense.
Okay.
Mr. President.
Yeah.
Mr. Cantor, please.
Eric?
Mr. President, thank you again very much for having us and for staying with us for the 6 hours. Appreciate that. I don't know if you will after the 6 hours or not, but
I gather, let me just guess, that's the 2,400-page health care bill. Is that right?
Well, actually, Mr. President, this is the Senate bill along with the 11-page proposal that you put up online that really I think is the basis for the discussion here. So, but I do want to go back to your suggestion as to why we're here. And you suggested that maybe we are here to find some points of agreement to bridge the gap in our differences. And I do like to go back to basics. We're here because we Republicans care about health care just as the Democrats in this room. And when the Speaker cites her letters from the folks in Michigan and the leader talks about the letters he's received, Mr. Andrews his, all of us share the concerns when people are allegedly wronged in our health care system. I mean, I think that is sort of a given. We don't care for this bill. I think you know that. The American people don't care for the bill. I think that we've demonstrated, in the polling that they don't. But there is a reason why we all voted no. And it does have to do with the philosophical difference that you point out. It does have to do with our fear that if you say that Washington can be the one to define essential health benefits, there may be a problem with that. And that's the language in the Section 1302 of this bill, that it says that the Secretary shall define for people what essential health benefits are. But let's, in the spirit of trying to come together, let's try and say maybe if we assume that Washington could do that, could really take the place of every American and decide what is most essential, what would be the consequences? And that's also where we have a big difference in this bill and what would happen. First of all, the cost. And John Kyle laid out the tremendous costs and the nearly $1 trillion of this bill, and I don't quite know because CBO said it couldn't assess how much your additions would cost to it, but we do know that there are plenty of taxes on income now. You suggest investment income should be taxed. We have additional taxes on medical devices and the rest. What is the consequence of that? We know there are consequences that small businesses will feel because of the impact on job creation. But also, Mr. President, when we were here about a year ago across the street, you started the Health Care Summit by saying one of the promises you want to make is that people ought to be able to keep the health insurance that they have. Because as we also know, most people in this country do have insurance, and overwhelming majority of people do like that coverage. It's just too expensive. Well, the CBO sent a letter, I think it was to Leader Reid, about the Senate bill, and in that letter it suggested that between 8 million and 9 million people may very well lose the coverage that they have because of this, because of the construct of this bill. That's our concern. And so as we are in the market, in the section of this discussion about health insurance reform, I know, Mr. President, that you have suggested strengthening oversight of insurance premium increases because we want to make sure that there aren't excessive insurance premium increases that take place. The problem is when you start to mandate all of the essential benefits, there are going to be some insurance premium increases. None of us really want to see them, but if you stop them, who's going to pay for it? Well, when we get back to the fact that businesses won't be able to pay for it and people are going to lose their coverage. So I guess my question to you is, in the construct of this bill, if we want to find agreement, we really do need to set this aside. And we really do need to say, okay, the fundamental structure is something we can agree on, but there are certainly plenty of areas of agreement. And because I don't think that you can answer the question in the positive to say that people will be able to maintain their coverage, people will be able to see the doctors they want in the kind of bill that you're proposing.
Well, let me, since you asked me a question, let me respond. The 8 to 9 million people that you refer to that might have to change their coverage, keep in mind out of the 300 million Americans that we're talking about, would be folks who the CBO, the Congressional Budget Office, estimates would find the deal in the exchange better, would be a better deal. So yes, they would change coverage because they've got more choice and competition. So let's just be clear about that, point number one. Point number two. When we do props like this, you stack it up and you repeat 2,400 pages, et cetera, the truth of the matter is that healthcare is very complicated. And we can try to pretend that it's not, but it is. Every single item that we've talked about on the Republican side, if we wanted to exhaustively deal with fraud and abuse, would generate a bunch of pages. So I point that out just because, these are the kind of political things we do that prevent us from actually having a conversation. Now, let me respond to your question. We could set up a system where food was probably cheaper than it is right now, if we just eliminated meat inspectors. And we eliminated any regulations in terms of how food's distributed and how it's stored. I'll bet in terms of drug prices, we would definitely reduce prescription drug prices if we didn't have a drug administration that makes sure that we test the drugs so that they don't kill us. But we don't do that. We make some decisions to protect consumers in every aspect of our lives. And we have bipartisan support for doing it. Because what we don't want is a situation in which suddenly people think they're getting one thing and they're getting something else. They're harmed by a product. What Secretary Sebelius just referred to, which is not a Washington thing. In fact, state insurance standards in many states are higher than anything that's done in Washington, is as a consequence of seeing consistent abuses by the insurance companies and people finding themselves helpless to deal with them. Now, we can have a philosophical disagreement about how much insurance regulation is appropriate. What you've indicated to me, just based on the bills that I've seen, is you guys believe in some regulations. You already said you did. You believe in making sure that you can't just drop somebody with coverage. Now, if you don't have a law there, let me tell you, that happens all the time. I've got a bunch of stories in here of folks who thought they had insurance, got sick, the insurance company goes back and figures out a way to drop them. I'm not making this up. I'm not trying to just add to the pages of that bill. It's in response to an actual problem, and you guys have agreed to it. So, philosophically at least, on a whole range of issues, you agree that we should have some insurance regulation. My suggestion had been that we try to focus on what are the specific regulations, since we agree that there have to be some. What are the specific ones that you object to? Now, let me just close by saying this. Pre-existing conditions is one that theoretically we all say we agree on. Theoretically, everybody thinks it's a bad deal if my wife's had breast cancer, I lose my job, I now try to buy insurance, and they say, well, you know what, we can't cover you because your wife has a history of cancer. We all think that's a bad deal. There are two ways of dealing with that. One is what Kathleen raised, which is a high-risk pool. You could say, you know what, you can go in and buy it in a big high-risk pool. And by the way, you could probably set up a high-risk pool without having as many pages in the bill. And it's an option that's been around for 30 years. Here's the problem. What happens is the reason that all our rates as members of Congress or as elected officials are pretty low is we've got such a big pool. There are millions of federal workers. And as a consequence, any single one of us have cancer, any single one of us have a child with a disability, our costs are spread out over millions of people, and so all of us are able to keep our rates relatively low. Even though if any individual in that situation was trying to buy insurance, it would skyrocket. That's the concept of pooling, is you get the healthy people and the young people alongside the not so healthy and the older people. But we're all kind of spreading our risk because each of us don't know at any given time what might happen. Maybe our kid's the one who gets diagnosed, heaven forbid, for something. And as a consequence, we insure ourselves by making sure that we're also insuring somebody else. When you get into something like a high-risk pool, what happens is all the sicker, older people are in that pool. All the younger people, they end up getting really cheap rates, and overall you could say, well, that's how the market works. It's a good thing. There's more choice. There's more choice for the young, healthy person, but not for the person who, heaven forbid, got sick. Now, on pre-existing conditions, we've got a similar situation. The challenge we have, I'd love to just pass a law that said, insurance companies, you can't exclude people based on pre-existing conditions. The problem is, what they'll say to you is, well, you know what prevents somebody from not buying insurance until they get sick and then going in and just buying it and gaming the system? So we've tried to respond to a difficult problem by saying, well, let's make sure everybody has some coverage. Without that, it's hard to do. So I just wanted to respond to, yes, we've got a philosophical objection, but let's not pretend that any form of regulation of the insurance market is somehow some onerous burden that's going to result in terrible things happening to consumers. That's a good thing.
Mr. President, if I could respond.
Please.
We again have a very difficult bridge to gap here because I know that this is something that we don't want to look at, but these are, as you say, the complexities of what this is about. But when you start to mandate that everyone in this country have insurance, and you lay on top of that now the mandates that we all would like to see in a perfect world, there are consequences to that. We just can't afford this. I mean, that's the ultimate problem here is in a perfect world, everyone would have everything they want. This government can't afford it. Businesses can't afford it. That's why we continue to say go step by step, try and address the cost, and we could ultimately get there. But we're asking that you set aside this mandated form of insurance this mandated form of health care regulation, and let's go back to things we can agree on without this trillion-dollar attempt here. That's all.
I think the cost issue is legitimate, and whether we can afford it or not, we'll be discussing that. And I think that's an entirely legitimate discussion.
Mr. President, could I have 10 seconds? Literally 10 seconds. We don't have a philosophic disagreement. If you agree that you can't be dropped, there has to be dependent coverage, if there's no annual lifetime cap, then in fact you've acknowledged that it is the government's role. The question is how far to go. So this idea we have a fundamental philosophic difference, you're either in or you're out. You say the government can't do it, none of it, or they can do some of it, we argue how much.
The cost issue is legitimate. We're going to address it.
Mr. President, if I could, it's the cost issue, but it's being driven by the fact that you've got in the bill, which I assume that your proposal supports, that the Secretary define what a health benefit package should be.
Only in the exchange. Only as part of the pool that people who don't have health insurance would buy into. If you were working at a big company that already has a big pool, then but you know what, I want to make sure, because Eric, we're going to end up in a back and forth that cuts everybody else out. I've got on the Democratic side a couple of people that want to speak, and there are probably a couple of Republicans. We're already over time. I've burned some of it. I apologize. I'm going to go to Luis. Then
to Mike Enzi.
Mike Enzi. I'll go to Tom Harkin, and then go back to Dave. So I've got 5 speakers, and I don't have a lot of time. Go ahead.
Thank you, Mr. President, and thanks to all my colleagues for being here. I am pretty succinct and pretty timely. I will not take up a lot of time, but I sure do have to say some things. The first one is the pre-existing conditions absolutely has to go. It is cruel, it is capricious, and it is done only to enhance the bottom line. This was not even anything we talked about 10 or 15 years ago, but it was mentioned that all Americans should be treated the same. Let me give you a little history on that. 8 states in this country right now have declared that domestic violence is a pre-existing condition on the grounds, I assume, that if you've been unlucky enough to get yourself beaten up once, you might go around and do it again. 48% is the higher cost for women, in many cases, to buy their own insurance. Believe you me, that is really discriminatory. In 1991, women were not included in any of the trials at the NIH because we had hormones. It wasn't until we had a critical mass of women here that said this will not do for more than half the population of the United States who pay taxes, that we made certain that diseases like osteoporosis, mainly a woman's disease, cervical cancer, only a woman's disease, uterine cancer, and others were really looked at. Up to that point, 1991, all research at the Institutes of Health was done on white males. Now, think about that for a minute, if you will. We couldn't do that because we said, kindly, would you stop doing that? It took legislation. Doing this will take legislation. I've been through this before. I was here when we had the Clinton debate. It was started, some of you will remember, by Lee Iacocca, who said we cannot export our automobiles. There is a $1,000 cost for health care in every one of them. My competitors are way ahead of me. They are eating my lunch. That was one of the main reasons, Mr. President, if you recall, that we decided we had to do something about that. In the 13, 15 years since that's happened, we have done nothing about health care. We don't export so much anymore. The automobile business is basically gone. We have done nothing to encourage entrepreneurs. The speaker spoke of this morning. We need to think more about the economic benefits of doing this. Those of us who are trying to redo some trade policies and maybe let us make something else again in the United States really want to make sure that it succeeds, and this would be a great part of that. I think it's terribly important that we do that. Also, since the Clinton health care plan, we've seen some pretty awful things. We saw hospitals abandoned to the streets, critically ill, elderly, mentally ill persons, and there was no great hue and cry out there. And now I understand there is actually a proposal, which God knows I hope never sees the light of day, that shut down Medicare and turned that into a voucher system, and where obviously we would not pay the full cost of health care, as these poor people have to go to the public market and try to find some. So what are we going to be doing then? We're going to be, once again, abandoning our elderly, abandoning our mentally ill, and our seriously ill to the streets. We're better people than that. I think it would be really a good thing for us today, while we're here in this room together, to really think about what's absolutely important here. Not nitpick over little pieces of this and that, but think about all the people out there every single day. The number of people with excess deaths because they have no health insurance. I even had one constituent, you will not believe this, and I know you won't, but it's true. Her sister died. This poor woman had no dentures. She wore her dead sister's teeth, which of course were uncomfortable, did not fit. Do you ever believe that in America that that's where we would be? This is the last chance as far as I'm concerned, particularly on the export business. We have fallen behind. We're no longer the biggest manufacturer in the world. We've lost our technological edge. We have an opportunity to do that, but a major part of the success of that is getting this health care bill passed. Thank you very much.
Louise, thank you. I was just informed. And by the way, this has been a terrific conversation so far. The House had to schedule a vote on an item, and my understanding is it has already started. So what I'd like to do is this. We've got 4 remaining speakers, Mike, Enzi, Dave Camp, I guess, again, and as well as Tom Harkin, 4 remaining speakers, and Jay Rockefeller. What I'd like to do is to break so that the House can take the vote. When we come back, we will start with Mike, and we will return to finish up the issue of insurance reform, and then we will move on to the questions of coverage. All right?
Mr. President, can I
so we are scheduled to be back here at 1:45.
I just want to inform the House members, Mr. President, there's only one vote. The vote is on. Obviously, they'll hold it until we get there, but we need to vote and then come right back.
All right. Thank you, everybody.
Buses outside.